Family and YouTube family. I want to apologize that we're starting a little later today. We've had a very busy but great weekend with the grandkids. So Brian and I just welcome you all to our show this evening, this beautiful Sunday evening. The weather really has been great for us. It's been really hot, but later in the evenings it's really beautiful. It's great walking weather and good to get out and just clear your mind a little bit. Do want to remind everybody to be cognizant of COVID and please wear your mask even if you've been vaccinated, and think about those that are in the hospitals that are fighting for their lives, thinking about those that are on the front lines that are risking their lives to save your life. So I do want to ask that you remain cognizant of that, and if you have not been vaccinated and you are still reluctant to do so, do your research. I'm not telling anybody what to do or how to do it, but I do want to encourage you. Do your research and get vaccinated. As a healthcare professional for over 34 years as a nurse, I would challenge anyone to, at this critical time, if they don't get the vaccine, it is imperative based on what we're going through and thinking about our children. We got the young children to also consider now. So let's be mindful of that as well. Okay, thank you.
Well, good evening, Facebook family. As Janice said, let's be diligent. We knew COVID did not go anywhere.
Yes, we've been saying that.
Yes, so I think it's just it's interesting to see that now. With the government mandate to initially, I guess, loosen the ropes on mask mandates and loosening the ropes on the social distancing and not putting out as many warnings as it relates to just basic hygiene with washing your hands, but, things of that nature.
The Alabama governor, though, Brian, I want to interject here. Governor Kay Ivey is the one that made the statement that even the president used, stating that.
Well, they're echoing her
sentiments on why people are not getting vaccinated. Mm-hmm. So we do want to piggyback off that. She is definitely now speaking up for people to get vaccinated. Now, we still have not, she has not placed mask mandates, and I don't know many governors that have. It's a few of them out there that have, but Alabama's governor has not. And my thing is, being in the hospitals like I am, and going in and you're taking care of people that chose not to become vaccinated, but they're expecting, it is our duty as nurses to take care of those patients. You know that we got to feel some kind of way knowing that these people were not vaccinated, ending up with COVID, and that we've been saying, get vaccinated. And here it is now, a year and a half later, and people, not a year and a half later, but 8 months later, and people still have not gotten vaccinated, knowing the death. And you got to listen out for this very carefully. Who is this? And Brian and I were talking about this earlier, and I want him to elaborate on this more. Who is this virus affecting more than anybody?
Mm-hmm. Okay. And we know that it's affecting the African American community more than any other community right now. I think it's an interesting point with you bringing up the governor of Alabama. If she had, I'm going to not just look at the, what she's saying now as it relates to her statement was that she can't make people get vaccinated, that it's the unvaccinated that's causing the problem. Mm-hmm. But you, in the beginning, was the same governor that was pushing the whole concept of not wearing masks and that being a violation of people's rights. And you were the one of the governors that did not push vaccination initially. And now you're doing a 360 because Alabama is on the
It's at the
radar.
Yes,
we are the worst state out of all the states in the union. We have the lowest vaccination rate than any other state. So now, and now that the news media is questioning why does Alabama have such a low rate, what's being skipped over is that she did not push the vaccine early, and particularly she was not pushing it in the predominantly black areas early. Okay, and a lot of what she did stifled people from getting the vaccine.
Yes, it did.
And not only that, she did not go in as it relates to businesses and put in place protocol. You understand? Not only to prevent some of what is happening right now, but also to help the local businesses. So none of those things are being addressed as it relates to. So now she's kind of under the gun. So as well as the kudos are coming based on the governor saying that there's nothing she can do about the unvaccinated and people not getting vaccinated, tell her what she could do. I could tell you what you should have done initially, as well as what you should do now, which she's starting to step up, and they've put a COVID committee together again to try to ward off some of the Delta, the variant patients that are coming in. And now we're seeing that the hospitals are full to capacity again.
We're overwhelmed.
So
definitely,
when we look at, and this thing boils down to, and we understand that in the African American community, vaccines have not been our friends. Okay, so I understand the hesitancy as it relates to vaccines. When you look at some of the things that have been done, people, normally will go back and point to the Tuskegee syphilis experiment. That's correct. They'll go back and they'll point to the surgeries that were done on women. Okay, as it relates to just their pregnancy or
being traumatized.
Yes, all of those things. We can go back and we can point to those things historically to see the hesitancy when it comes to African Americans getting vaccinated.
Yes.
So what needed to be done as it relates to that was the assurance, getting more information out to these communities that are African American descent, especially if the main persons that are getting COVID are persons with underlying health issues that predominantly affect African American communities, such as diabetes, hypertension,
cardiovascular disease,
heart disease,
hyperthyroidism.
All of these diseases are more dominant in the African American community. So there should have been information put out in these communities that would promote the safety of the vaccine.
Yes.
And not only that, promote the saving of lives as it relates to people of color in those communities that suffer from those diseases, that they would be less susceptible to death if they received the vaccine. Not that the vaccine would stop them from getting COVID, but it would at least deter death in the event that they got COVID. So all of those things, and like I said, historically, we can point back to that, and I understand the hesitancy. I think there needs to be more information given out by not only the state, but the medical community has to step up. So your State Department, health officers have to step up. and to make sure that they're educating our community as it relates to this Delta variant. And still, you still have COVID that's out there as well as the Delta variant.
Yeah.
You understand what I'm saying? COVID hasn't gone anywhere. Now you got the Delta variant, the mutation of COVID. They say that, quote unquote, that this Delta variant is more susceptible.
Yeah, of course it is.
And
Anytime
that
you
is
have
more contagious.
Yeah, but whenever you have a virus that replicates, the replica of that virus is going to be stronger.
Mm-hmm.
And I tell people, I had the opportunity to talk to some people that were not as how do I phrase this without offending anyone, that was not as astute on speaking about or understanding the medical part of what this virus is. So I had the opportunity to just put it on a very elementary level. And the best way I can get people to understand what this virus is, not the virus, but what the vaccine is. It is not a live virus. People think, it's not like the flu. When you get the flu vaccine and the pneumonia vaccine, those are live viruses. The COVID is not, the COVID vaccine is not a live virus. It is a messenger type vaccine. All it does, once it's injected into you, it mimics.
It's a clone type.
COVID.
Right.
It mimics it to the hilt. And what it says is, I'm here in your body. So when you come in contact with the real virus, COVID virus, you got the messenger in your body that's saying, you don't need to be here because I'm already here. This is what your messenger virus is saying. I'm here. So I see you. So you don't need to be here. I'm here. Mm-hmm. So therefore, you do not contact the virus. I don't
so
know.
Does it? Let me ask you this, and that's great point that you're just giving us some information and educating us on this. It wants the virus when we get the vaccine, the prototype virus that we're actually inoculated with.
Right.
Does it? Once it enters in the body, does it develop any antibodies to fight off the virus if you get it? So I know that it sends a signal or message, like you said, that says, I'm here, you don't belong here. Does it also build antibodies? Does the vaccine?
It builds antibodies, but they're not actual antibodies. And let me phrase this to you. If you get the vaccine and you've had both injections, and say 2-3 months later, you go and get the blood test to see if you have the antibodies in your system, yes, it's going to show that. It's going to show that those viruses are not identical. Let's make that it's as close as you can get it. The vaccine as relation to the actual COVID. They are very similar, and that's why I say it's a messenger. It just sends a signal saying, I'm here. So when you go to get your blood test done to see if you have antibodies, yes, it's going to show that they are present. That is how they are able to determine how soon do we need to give a booster. And that is what the study is doing now. When is the booster needed? Right now, we don't know. But we know it's coming up. For those that got the virus when it initially was instigated in January, late January, February, they're coming. Those people are still safe, but it's coming around. So in saying that, the timing in which you got the virus may be critical to the extent that you're easily able to contract the new Delta variant.
Right.
You have people that got the virus in June. You got people that got their last virus in May. Okay?
Got the vaccine.
I'm sorry. Got the vaccine in May. I'm sorry. I made a mistake. Got the vaccine in May. So those people are still got that messenger there saying, I'm here. I'm here. So in essence, when January or February rolls around again, it may be weakening in our bodies because the antibodies do dissipate. They die out, you guys. They do. That is why it is so imperative that you use your protection, your mask, your distance, your hands, because we see this in the hospital every day. People do. All I did was put my hand in my face.
Yeah, but at what point would the body develop a self-immunity to this virus? Just say, for instance, because I never get the flu shot.
Right.
When I got out the military, that was the last time I had a flu vaccine because the military made us get it.
Right.
So I have not had a flu vaccine in over 20 years now.
Okay.
So, and I never get the flu.
Okay.
So will the body actually at some point say that, I get it, COVID is here to stay, it's not going anywhere, it's just like the flu, and develop its own immunity to this particular strand of virus, just like all other viruses, and eventually this virus fades and weakens itself.
Yes. Well, what the study is showing now is that the healthier your immune system is, the more unlikely you are to contract this virus. We have to understand this is new to our body.
And can you tell us what the difference between the Delta strand is and the original COVID strain?
Yes. Everybody knows that the original COVID came from a lab, supposedly in Wuhan. And with that being said, it was a man-made virus.
Well, what was some of I know that everybody talked about the spikes that were on.
The spikes are on the initial COVID virus. There are spikes on the Delta virus, but they are more plentiful spikes, and they are more susceptible to making you sicker. And it's almost like, for those of you that remember staph infections. You remember that? For staph infections, we had a basic antibody that could kill those staph infections. Well, people were not taking all of their medicines, so the staph had a chance to mutate, and it became resistant to the antibiotic methicillin. So now they call it methicillin resistant Staph aureus. That means it is now resistant to the main antibiotics that was killing it. This is the same thing the Delta variant is doing. For those people that were out there infected and maybe didn't even know that they had COVID. You understand? So they were still going out, hanging out with other people, partying, living life,
and passing
that virus on and on and on. That virus had a chance to just strengthen and mutate. When you talk about a virus mutating, all you're talking about is getting stronger and more powerful. And as a virus gets stronger and powerful, they have to change the name to it because guess what? They got to treat it differently.
So now let me ask you, Janice, and we've heard that, the CDC has put out that the vaccine, if you have the vaccine, that it will not prevent you from getting COVID or the Delta variant.
That's correct.
But it will
lessen the symptoms.
Yeah, lessen the symptoms and keep you from, if you have any comorbidities, it may possibly save your life if you have the vaccine.
It will. I see it every day. It will do it. I've seen several patients that have actually had the vaccine and they've tested now, and I'm telling you, this is real. They are testing positive for the virus now, but they have absolutely, some of them, no symptoms at all. Testing positive. And I'm not talking about the swab of the nose. I'm talking about we're actually, there's a deeper lab thing that they're doing now to determine the actual,
if you have
the Delta versus just the first COVID. So with that in mind, you have to remember that you can get it again. but you may not have any symptoms. You may have gotten the vaccine and you may not exhibit any symptoms. You may not even know it. We could be sitting here carrying it right now and thinking, man, maybe have a little sinus infection, because a lot of us battle with sinuses, and it actually could be that Delta variant. But we don't feel any way less as far as health-wise. We don't feel like there's basically anything that's going on with us. But there are some people that have gotten this thing a second time that they are in the hospital and they are on the ventilator. That is true.
Mm-hmm. So we should be, family, taking the necessary precautions. As Janice has said, we should follow those warnings from the CDC.
Yes.
And make sure that we're masking when we go back out in public now, especially if you are in Alabama, being that Alabama is the lowest state in the nation as far as vaccination rates. So the safety measures that were recommended by washing your hands, doing all of those hygienical things that need to be done. We want to continue to encourage you all to do that. We can't tell you what to do about the vaccine.
No, we cannot.
Or, that's your choice, but we can only give you information that we have researched. And Janice, everybody knows, is 30 plus years nursing experience, wonderful nurse. And a wealth of knowledge as it relates to the medical field. So we want to make sure our people are safe, because our community is the most affected at this particular time than any other community. And it's just the numbers are there. You can go to the CDC website and you can look that up for yourself. The Black community, African Americans,
and Hispanics
are dying from this COVID disease.
Yes, they are.
More than any other community. Our counterparts, European brothers and sisters, are not affected as much.
They are not.
So the numbers are there to back that up, and to say that you need to protect yourself however you choose to do it. Make the wise choice is what we are encouraging our families to do. Our YouTube family, our Facebook family, our friends, loved ones, please take care of your health.
And then, Brian, I want to share this right quick. I've had several people to reach out to me and ask me about the children. And I tell everybody, make sure that you put your children on multivitamins if they're not on multivitamins. Make sure you get them the little gummies. They're wonderful. Also, limit the sugar intake for your children.
Yes, cut out the candies, please.
Leave the candies out
Leave
and the cake, the sodas. Cut it out for your children. And that's for us as well, not just for your children. That's for us. Yeah, look what I'm drinking. Brian, they can't see that, huh? Only you can see. But anyway, go with your fruits, your natural, as many fruits and vegetables as you can get. There's also a vitamin out there. It's called Fruits and Veggies. That is a good supplemental vitamin that for people that can't get an adequate amount.
That don't eat as much fruits and vegetables.
Right. Yes. And that's great for children as well. And I tell people, we got to be mindful. Most of us, a lot of us may be, on the downswing as far as our work career and having to be out in the community and all that stuff. But we got to look out for our children. And we got to protect those children because they are our future. And if we don't care about them, then who does? So let's make sure we watch these kids. Don't be giving them all this candy and cookies and cakes and pies and canned sodas. And if you're giving them juices, make sure those juices are limited in sugar.
Limited in sugar, not from concentrate, but actually coming from the real fruit itself.
Yes.
And that the sugars are the fruit itself. Sugars.
That's right. And there's the popsicles out there.
There are no added
sugars.
So when you look at those juices, if you go to the back and you look at the ingredients, it will say no added sugars.
And you're getting the
So
exact amount of sugars that's in
the fruit.
in each serving.
Yes.
And a lot of kids like popsicles. I know it's very, very hot, and I understand that. But they make the fruit popsicles, and they are good. They're good for us, you know. And I say give your kids yogurt because that's a healthy probiotic that they're putting in their digestive system because COVID loves the digestive tract. COVID loves fat. It loves unhealthy stuff. Anything that in your body that's unhealthy, COVID's going to attach to it. I can promise you that. So get your colon healthy. Therefore, if you come in contact with this stuff, you can expel it. You can get rid of it.
Drink plenty of water.
Water is the key.
Drink plenty of water.
I hear this all day, every day, and I am guilty of it. I'm trying, but water is the vital nutrient. It is.
Yes.
It is,
absolutely.
and we need it. And Brian, before we close, I do want to add one other thing that I want you to shed some light on, and that is the eviction piece that's come out.
The eviction moratorium is coming to an end with the federal government. And we know that those that have taken, advantage of the eviction moratorium and not having to pay rent and have utilized those, funds to continue to take care of themselves, that is going to be ending, guys. And I think that's going to be ending this coming weekend.
Yeah,
after today.
Yes.
So we are, we need to be, if you have not done so, you need to call your senators. Senators, the Congress and the Senate have gone on a 6-week hiatus. So basically, the moratorium is going to come to an end and people are going to be put out of their apartments, put out of their homes. And it's just unnecessary. The predominant community that is affected, as in everything, and I've often say this and have heard many other African Americans say this, that when America catches a cold, black people catch pneumonia because we've already had the cold.
Yes.
You understand? So when America goes through a recession, black people are in a depression because we've been in a recession for 400 plus years.
Wow.
So we have always been the ones to suffer the worst, no matter what happens, and no matter, the severity of what happens, black people always get the short end of the stick. So quite naturally, this is affecting black people that rent. And the majority of renters are black. And you're Hispanic, falling into your color category. So those are the two groups that are going to be affected the most. So I'm encouraging you, do what you need to do. Make a phone call, do something to try. Even call your state representatives to encourage them to call.
Well, Brian, I've always and I'm gonna play the devil's advocate here, and I may get some backlash on this, and that's okay. I just have to ask this question. If I'm wrong, I accept that, but I don't know, so I'm asking for people that were not working during the pandemic and they were getting unemployment. We know that some states got more than others. We know what Alabama got, but we don't know what other states got. Couldn't they use that money that they were bringing in every week to pay their rent?
Well, you don't know the people's living condition, and I always say this. So no situation is the same. There are no two situations the same. So you don't know. So
you can't say that some people didn't do right by that money.
That's exactly right. Absolutely. You can. If you say that and then you stereotype that to everyone, then you're not making an accurate statement. There's no way that we could say that. So we don't know. It's not up to us to even judge what people did with the unemployment and the stimulus money that was given in addition to the unemployment that the states gave. Only thing we can say is, and I've said this from the beginning, black people, if they got unemployment plus the state unemployment, the federal government unemployment compensation plus the state, they deserve it. We have worked for this country and have done more than any other group and been undercompensated more than any other group, been unfairly and unjustly treated than any other group. Black people have never been paid their worth as it relates to wages. We've always been underpaid as it relates to our counterpart, be it male or female, and any other group coming in to this country that would fall into the immigrant category. So black people have always been at the bottom of the totem pole when it comes to the pay structure. Even now, even with the government putting out certain laws. But if you were
paying your money, if you were paying your rent when you were getting paid on your job.
But that's the thing. We don't know. You don't know the circumstances. So that's why I started by saying each individual situation is different.
Yeah.
You know, I heard a young lady on the news, and they just had her on there. She was giving her testimony how she did do the right thing by her unemployment and the stimulus unemployment coming from the federal government, and it took all of that just for her to feed herself and her 3 children. So she got behind on her rent, and she was paying her rent as well. She got 3 months to 4 months behind. So it's not like she wasn't trying when that was out. So each situation is different. But, you know, I hold to the, the concept that whatever black people can get, we need to try to utilize that to build our communities and to make our communities safe. What do I mean when I say that? When I say that, I'm talking about the unification of the black nation as one race. We have to, at some point, come to a place to where we define ourselves as a black nation and began to pool. And we've heard this for 50, 60 years. And people will probably say, Brian, you sound like a broken record. You sound like you're a Garveyite, or you Malcolm. You would have been, rolling with Malcolm when he was. Yes, I'd have been rolling with all of them. And King too, if it's for the rights of our people. But it was, we have to get back to what the vision they had, which was unification of the black race. Not all of these other things that we've fallen into, which are gender specific, gender unspecific, we're rolling now with different color brands and different race mixing brands. We've got to get away from that and get back to focusing on the strength of black people, black families. I've got a shirt on that says Black Fathers Matter. Black fathers, black mothers, and black children, and unifying a base around that. If we do that, and then from that point, bringing our monies together as a black nation, when we do that, you have a safety net for the young black mother that's out there working 2 jobs, got the unemployment, got the federal stimulus, did all she could, but still it's not enough to take care of herself and her 3 babies. You understand? And now she risks being homeless, living out of her car, trying to go to work, trying to get her kids to school, and black fathers need to step up. Black men need to step up. My question is, okay, the young lady is doing all of this. Where's the daddy to the 3 children? Where is his contribution to helping his children's mother offset some of this? Yeah. So, we have to, as black people, first recognize that we are not in a position at this point, historically, that's better than where we were 60 years ago. And we need to look back, you understand what I'm saying? And see what our ancestors had that unified them, that made them a thriving community prior to integrating, prior to gender, specifications. All of those things, we need to look back to the black community, because even back then, and we were talking about this, in the black community, there were many different issues that we dealt with.
Yes, yes.
But they were never taken outside of the community, and we dealt with them within the community. That's where right. We did not look down on each other. We did not ostracize each other. We didn't stereotype each other. All of that came in with the creation of propaganda in the mid-60s via the media. You understand what I'm saying? And even before then, when the black and white movies, everybody point to D.W. Griffin's movie, The Birth of a Nation, okay, that was shown at the White House, where it depicted the black male as a rapist, as a liar, and see, as someone that violated the rights of white women and white people. And eventually in The Birth of a Nation, this film, they hanged the black man that was the violator, but that was the stereotype that was put out. You see? So, and from that point, media, it started actually before then, because the black woman was depicted as always as a helper or a mammy, always one nursing the white female's children. She was only good for, that use in a white person's household. She was rejected by most of the white women because of her body shape, things of that nature. So we can go back and we can see the problems as it relates to mixing, and as it relates to the integration issue. And we can see the problem with financially how it has separated and divided black people along the lines of the haves and the have-nots, based on certain educational, achievements, based on self-achievement, based on individuality instead of collectivism. So we have to get back to blacks function better as a collective group. What the governmental propaganda did to us, it did something to us that it did not do to any other group, because no other group allowed it to. But no other group was subjected to what we were subjected to by way of slavery. But what it did is it divided us based on those individual achievements, based on family structure, based on different families that were set up as relates to what Europeans considered to be normal. We talked a little bit about that last week, and that's why, and I was pointing this out to Janice last week, every black school under Reconstruction, every college that was formed by the Christian mission societies, the American mission societies, basically those church societies, were called normal schools for colored people. Why were they called normal schools? Because prior to that, we were considered to be abnormal. So when you look at that, the way families were structured in the black community was based on those individual achievements and based on educational achievements. Okay? So if you did not fall into that category, That's why Booker T. Washington and W.E.B. Du Bois, that's why there was a line drawn between them. Because on Booker T's side, he says, hey, black people can do for themselves. Let's educate them in trade skills, get them agricultural skills, industrial skills, all of these things that they need to build their communities and to be self-sufficient. Well, Booker T said, I don't have a problem with that, but we also need the educational portion of that as well to factor into the black community. So with them having the skills, they'll also have the education on how to function in a society that's been created to keep them out of achieving anything that would be deemed successful. Mm-hmm. So even if they get the skills without the education, without the legal knowledge, without the political knowledge, without the financial knowledge to know how to manage those businesses and self-sufficiency that they create, they're still going to be inadequate in society. So it's about bridging the gap with those two. Okay, and that's what people never talk about. Booker T and W. Du Bois were not enemies, like people try to make them out to be. That's somebody that have never done the study on Booker T. Washington. And they do not talk about, prior to W.E.B. Du Bois moving to Ghana, him and Booker T coming together to actually work together. So those are things. We have to get back to some of those things if we are going to, at this particular time in history, if we're going to survive as a people. Because the plan based on the United States government now is to continue to deplete the black race till there is no longer, and I'll continue to say this, you all will get tired of hearing me say this, until there is no longer a group of people that can be considered as African American. And that the once African American will all fall into the color category based on the mixing, the division, the sexual classifications, okay, that it will literally do away with what group we know now as African American or black. Once that happens, and excuse me, there's a real good book called The Hot Zone that deals with some of this. Okay, once the government does that, when there's no classification as African American anymore, and you now fall into the color category, the dominant group, the majority, which are the Europeans, okay, in the color category, this is key that most people don't talk about. In the color category, you can have Europeans in the color category. How do you say that, Brian? Because those immigrants that are coming from Italy, that are over here, we know the Italian immigrants have been over here since the 1920s. Those that are Spanish, not Mexican, but Spanish. Those that are Portuguese, okay? Even those that are coming over here from South Africa, and some other parts of Africa, can categorize themselves as European to maintain the dominant status quo, which is white majority, to rule the subordinate group. So your mulatto group, if we go back and we look at Haiti, Haiti is a perfect example of this. The mulatto group that is being created in the United States right now will fall into the management class of those who are once or now descendants that become descendants of the African Americans, and those that are descendants of African Americans will be isolated to mediocre, what we know in third world countries as slums, jobs, So their living condition will not improve. These rural African American areas will become no more than slum infestations. They will become the breeding ground for Europeans to rape them of their land and continue to industrialize certain areas and pockets around them until eventually the blacks are relegated to another form of slavery all over again. The mulatto class will be the management class. So we have to get back to, just to understanding what's going on. In my opinion, I don't know if blacks are really concerned about this. Some blacks feel like they've got it made and we're in a comfortable position. Mm-hmm. We're making decent money, and oh, Brian, we don't have to worry about that. That's how people feel. But I'm telling you, your grandchildren and your children in the next 20 to 30 years, it's a major concern. They are the ones that will be dealing with this. We need to educate them so they understand.
Yes.
You understand what I'm saying? So There you have it.
Okay, thank you guys for joining us this evening. Hey, Phyllis. Good to see you.
Phyllis.
Always.
Yes.
Thank you guys for joining us today. And we will be back hopefully next Sunday.
Absolutely.
We'll be on time, 6:30 p.m. And we look forward to seeing you guys. Again, thank you for joining us on another wonderful Sunday evening session. Facebook family, YouTube family, we love you guys, and we will definitely see you next week. Until then, be blessed and have a wonderful week.